In genetics, whenever there is these chromosomes are there, they are at the damage. They have the point mutation, they have the missense mutation, they have various mutations are there which can lead to the decrease or absence of globin chain. Chromosome number 11 has beta globin chain, chromosome number 16 has alpha globin. So depending upon what mutation they have, on which chromosome they have, it can be alpha or it can be beta thalassemia. So considering this, let's go to the ineffective erythropoiesis. That is what the problem. Usually it is normal hemoglobin contains four chains, alpha and beta. And that is why normal hemoglobin looks like this, where they have four actually iron molecules, two are seen, two might be on the other side. So it looks like four iron molecules and four globin chains. But whenever there is thalassemia, the beta chains are reduced. Let's talk about beta globin. So when beta chains are reduced, beta thalassemia, the alpha chains are there which are unmatched. They remain inside the bone marrow. If they are matched, the RBCs will be completely formed and released into the blood. But if the valence is not satisfied, 2 alpha, 2 beta, and then unbalanced alpha chains get deposited, that leads to the ineffective erythropoiesis and various manifestations like anemia, bone disease, bone changes, stunting of growth. All those manifestations are because of the deposition of this unbalanced or unmatched alpha chains. That is how it appears. So beta thalassemia is a common disorder in our country, which is actually most common cause, though it is chromosome number 11, though it is point mutation, we all know. But actual most common cause for beta thalassemia is unawareness. If you are not aware about the disease, your family might get the thalassemia because it is an inherited disorder. It comes from parents because of the genetic change. If the parents are beta thalassemia minor, chances if both the parents are beta thalassemia minor, so both the parents are minor, then chances are 25% that baby may be born with the thalassemia major. Just because we don't know our thalassemia status, whether we are minor or not, then baby is already born with thalassemia and then we start crying. So our youth, our doctors, our medical fraternity, our entire population needs to be aware about this. In Western world, they made awareness drive. They made sure that thalassemia minor knows their status, and if they are pregnant, then by doing the prenatal diagnosis, they have reduced to the incidence of this beta thalassemia to the extent of 0%, almost eliminated, and that can happen only with the awareness. That is why today we are here to make it aware, prevent, and treat these patients. So this is how it goes. If you have thalassemia minor, which is the most common condition, the second one, where thalassemia chances are, because minor people usually don't have any symptoms. They are just thalassemia minor, like Amitabh Bachchan. He is carrier of thalassemia. So Jaya Bachchan doesn't have thalassemia minor. Amitabh Bachchan's son, that is Abhishek Bachchan, is also normal. So whenever the two thalassemia minor ideally should not get married. Even if they get married, there should not be a problem. They should know their status, and whenever she is pregnant, we must do the prenatal diagnosis at third or fourth month. Once we get the diagnosis that it is thalassemia major, we can do the abortion. If it is not thalassemia major, which is the chance almost 75%, we can carry on with the pregnancy, and with that thalassemia born incidence will be less. But just because of lack of awareness, in India, we have almost more than 10,000 babies born with thalassemia every year. And that is why there is need for awareness.